Welcome to the Vitality Audit. I'm Dr. B, your host, Dr. Sirisha Bhandaru. This is your place to pause and to reflect. Today, let's talk about Jen. Jen is amazing. Jen had an amazing career. She was full of life and vibrant. She has been a patient in my practice at that point for a very, very long time. And she wanted to have a smile makeover because there was a big event coming up in her life. So as a part of the Smile Makeover, I have all my patients test for sleep apnea because clenching, grinding, broken teeth, crazed lines on teeth are an indicator that you may potentially be suffering from sleep apnea. That being said, the sleep test was completed. She did test positive for sleep apnea. I did refer her to a specialist to have the condition treated. However, the appointments and the process was taking a little longer. In the meanwhile, however, the smile makeover has been completed and it was beautiful. On the day we delivered the veneers and crowns as a part of the smile makeover, Jen decided to proceed with the oral appliance treatment for the sleep apnea because she did not want the alternative. At that point, there was only one alternative, that was CPAP. This was more than a decade ago. So we make impressions, molds, and send it to the lab. Jen's still waiting to see the neurologist to see if there is anything else that could be done for her obstructive sleep apnea diagnosis. And Jen calls me the day after the veneers have been delivered. And she calls me, tells the office that her lip was still drooping and her anesthetic has not worn off. That did not make any sense because the anesthetic usually wears off in 2 to 3 hours. I was worried and I had Jen come to our office for a follow-up appointment, and with one quick look, it was obvious that she had suffered stroke. We sent her to emergency room and the emergency doctor diagnosed her after a series of exams and tests that she had suffered from a condition called TIA. It is transient ischemic attack, mini strokes in the brain that obstructed the blood flow to her face, making the lip and cheek and half her face droop. This is very, very unfortunate. This could have been avoided. This could have been prevented had she been able to get the diagnosis sooner. However, that did not happen. This is not one isolated event. I hear stories like this over and over again. Sleep apnea has been researched historically as a man's disease. The media, the healthcare professionals, and all the marketing is directed towards men. Research has shown that men are more prone to sleep apnea than women because for every 10 men that were included in the study for research for sleep apnea, for every 10 men, I'm repeating it again, one female patient was included. So hear this out. Say you have a data of 1,000 patients. For every 10 patients, there was one woman. So for 1,000 patients, how many women do we have? I'm going to let you do the math here for a second. 10 women. There were 10 women in the whole 1,000 patients pool where the diagnosis criteria was being established were a part of the research. Hence the data in the women, hence the data for the treatment and diagnosis for women is completely different. Just like any other disease, like call it heart attack, stroke, diabetes, the disease presents differently in women because of the body composition, because of the hormones, because of the muscle mass than men. Let me take a little step back and explain to you what obstructive sleep apnea is. Obstructive sleep apnea is a condition where your airway, the back of your throat, collapses multiple times over and over again when you're trying to breathe at night. This obstruction causes hormonal dysfunctions, sleep interruptions, mood dysfunctions, anxiety, metabolic syndrome, a whole other series of health conditions. But the diagnosis and the symptoms that have been loud snoring, gasping for air, choking for air that everybody know about, has been established based on how the men um, show the symptoms. Women, however, show the symptoms very differently. They have palpitations, sweats, unable to sleep, anxiety, morning headaches, migraines, depression, hormone imbalances, especially hormone imbalances, because women's hormones are produced majority when they are asleep. When we sleep is when we get the hormone production, versus men where the testosterone, which is the main hormone, is produced 24 hours during the day. Sleep, the women that I treat in my practice, these are the symptoms they tell me. I'm tired all the time, but I can't fall asleep. When I fall asleep, I cannot stay asleep. I wake up very exhausted. My brain feels foggy. I feel anxious. I am overwhelmed. I don't have a reason to feel anxious or overwhelmed, but I feel that all the time. I'm doing everything, but I can't seem to lose weight, and I don't feel like myself, and I am tired of it. Another, the symptoms, the majority of the symptoms that women experience are chronic fatigue, poor sleep quality, morning headaches, brain fog, difficulty remembering things, anxiety, depression, palpitations. Because these symptoms are considered non-specific, especially as women age, all of these are assigned to menopause. Did you know that postmenopausal women are 3 times more likely to be diagnosed or suffer from obstructive sleep apnea than the premenopausal counterparts? Women who have poor quality of sleep are more likely to develop hormone issues and depression. The lack of sleep could be because of lifestyle, or it could be because of obstructive sleep apnea. So, when we're listening to all these health conditions that women are suffering from, and the research is finally catching up on it, what do you do when you have these non-specific symptoms? You have difficulty losing weight, your hormones are kind of in the normal range, you have anxiety, you have palpitations, you're not able to get that deep sleep, you've always been told you're a light sleeper, you get up with morning headaches. When you have all these signs and symptoms, what do? Be your advocate, ask for a sleep test. Ask to be tested for obstructive sleep apnea. And also, there is another situation that happens when women get tested for sleep apnea. There are two categories we need to take into consideration, because the diagnostic criteria has been established with men as the basis. And however, like we spoke about a little while ago, the symptoms in men and women are different, and hence the diagnosis is also different. Women have a condition that's called upper airway resistance syndrome, where there is a resistance in somewhere in the airway, nose, back of your throat, neck, whatever the area of obstruction is. Instead of having such deep dips in the oxygen, such extensive snoring and gasping for air, women don't hit that deep sleep. So the body prevents women from hitting REM sleep and having the oxygen fall so low. So the numbers look very different. For my women patients who are diagnosed with upper airway resistance syndrome, they experience every single symptom that a patient who has obstructive sleep apnea has. However, because women don't get such deep REM sleep, their oxygen drops and dips are not too low. The upper airway resistance syndrome in women is very misdiagnosed, undertreated, because insurance companies do not recognize it as a health condition that needs to be treated. And most women get the advice to go lose some weight or do some saline rinses, nose drops, something to that effect, which is not very effective. That being said, if you have any of these symptoms, if you have chronic headaches when you get up in the morning, if you have migraines in the morning, if you feel like your jaw is sore when you get up in the morning, if you're clenching and grinding, if you feel like you are a very light sleeper and every noise wakes you up, the dog barking in the neighbor's house, or somebody revving up in the engine at 3 o'clock in the morning, if all of them are waking you up, or for whatever reason you're always exhausted, you wake up in the middle of the night, you're having palpitations, you have anxiety, it could be a majority of other things too, but please do not forget to rule out obstructive sleep apnea. If you think this episode resonated with you, if you think someone in your life, your mom, your daughter, your sister, your friend, or your neighbor, or somebody in your team, somebody in your life is going to benefit from this, please share this episode with them. Please advocate for them. Have them get tested for obstructive sleep apnea. Till we meet next time, have a great rest of the day.